There are several aspects about Medicare and the Medicare process that can be very confusing and sometimes even overwhelming. And one of those aspects has to do with Medicare's open enrollment period. And so I'm going to explain to you enrollment periods, how they work, to make sure that you are making the right decisions at the right time. Now, first off, to understand enrollment periods, you have to realize that there are really two basic types of enrollment periods, two general types. One is getting into Medicare A and B to get your Medicare account set up. We have enrollment periods for that. And then buying other insurance products, drug plans, Advantage plans, supplemental plans. We have enrollment periods for that. The confusion comes because both of these are different, yet they use some of the same terminology. So let's get into it and talk about the first part of enrollment periods, which have to do with enrolling into Medicare A and B. So this is someone that's coming into Medicare and getting that Medicare account set up. We actually have three different enrollment periods or opportunities to get the Medicare card. One of those is called the initial enrollment period, acronym IEP. The next one is the special enrollment period, SEP, and then one is called the general enrollment period, GEP. Now the IEP is for those that are going to start Medicare at 65. Now listen, not everyone has to start Medicare at 65. The group that doesn't have to enroll during the initial enrollment period are those that they or their spouse are still working and covered by a group plan that has 20 employees or more. That group doesn't have to do anything with Medicare A or B, okay? And so they will come in using the special enrollment period. So those, though, that don't have a group plan they're covered by, if they're their spouses, 20 or more employees, then they have to start Medicare at 65. Now keep this in mind. If you're on Social Security, you're going to be automatically enrolled into Medicare, and they'll mail you the Medicare card about 100 days prior to your birth month. And so they mail that to you right before this initial enrollment period begins. And so if you're going to go on Medicare 65 and the card comes, then you have your Medicare enrollment set up. But if you have to start at 65 and you're not on Social Security, you actually have to self-enroll. So this self-enrollment process, this initial enrollment period, lasts for 7 months. And those 7 months are 3 months before you turn 65, the month you turn 65, and then 3 months after. So let's say someone's birthday is July 1, 1958. They could start their Medicare 7/1/2023. Those 7 months are 3 months before they turn 65, the month they turn 65, and 3 months after. If I enrolled the first 3 months before my birth month, my coverage begins right when I want to, July 1 in this example, 2023. But if I enroll in July, they start me in August. I enroll in August, they start me September. I enroll in September, they're going to start me in October. If I enroll in October, they're going to start me then in November. So that would be the very last month I can actually start if I'm going to enroll during this initial enrollment period. And again, if I have to start at 65, the smartest thing to do is to enroll in those first 3 months so that you do not go without any insurance. All right, so that's called the initial enrollment period. Many of you are going to do that. Now, the special enrollment period are those for people that started after 65. Why didn't they start here? Because they didn't need to. Again, they were covered by a group plan. They're their spouses. There's at least 20 employees in the group. They didn't have to do anything with Medicare, but now they're going to lose the plan. They're going to retire. Let's say they're 67 years old. So this initial enrollment period is long gone. Now we're going to come in using this special enrollment period. It's a different period. It's also a different process and additional paperwork that's involved. So what we have to do to come in at 65 without any penalties and any problems, we have to prove that you have had, or through your work or your spouse, you've had credible coverage. Work insurance plan that was covering you, and we have to go all the way back to 65 and prove that you've had credible coverage with no gaps whatsoever, not any months missing. You've had this continuous credible coverage. And the way we prove that is with a form called an L564. L564. And this form would be given to your HR department or whoever has the employment records, and they're going to verify that you or your spouse were working and you had a group plan, and they'll verify all the way back to 65. Now, if you've changed jobs after 65, then we'd have to get this from 2 employers. I've had as many as 4 employers, but we got to prove every month we've had credible coverage. So once we prove we have credible coverage, we have one more form that we're going to use, and this is called the CMS 40B form. And what this does is this lets Medicare know when we want to start our coverage. So if my group plan is going to end July 30th, I want my Medicare to start 7/1. And so this 40B form will indicate on there, please begin my Medicare effective July the 1st. So the L564 proves I'm eligible. The 40B tells them when I want to start. Now keep this in mind. We do not turn this paperwork in any sooner than 90 days prior to when you want your coverage to begin. So if I want my coverage to start July 1, anytime prior to that for the next 90 days, I can submit the paperwork. I'm not going to do this 4, 5, 6 months in advance. They will not process your application. They want that right around anywhere from 60 to 90 days prior. All right. And so that's the special enrollment period that people will use that don't start at 65 as long as they've had credible coverage. Then the last one we want to talk about is called the general enrollment period. Now, folks, this is the one you don't want to have to use. This is for people that made a mistake. And what they've done is they missed the IEP and the SEP, and so now they have to come in the GEP. Now the problem with this is this. We only have from January 1 to March 31st to enroll in the general enrollment period. So it's only open for 3 months. So if someone realized they made a mistake in April, it's too late. They're going to have to wait till the next year and enroll into Medicare later. And so we have 3 months to enroll. So if I enroll using the GEP, I put my application in January, they'll start me in February. If I enroll in February, they'll start me in March. If I enroll in March, they're going to start me in April, okay? And so these are the different enrollment periods that will allow us to come into Medicare to get that A and B set up. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now, once we have the A and B set up, we're going to get them some type of other insurance type plans. It is very rare that people have A and B alone. Most people will look at the A and B system and realize that's just simply too much liability. And so when we're going to set up an insurance plan, we basically have only 2 systems in which we can use. In either system I use, I'm going to have to be enrolled into A and B. Now remember, for most people, Medicare A has a 0 premium. As long as you have 40 quarters paid in to the Medicare tax system, your 40 quarters or your spouse's, A will cost nothing. The B this year, 2023, cost $164.90 a month. And this is something that comes out of your Social Security check. If you're not on Social Security, then they will actually bill you for this quarterly or set up a bank draft with you. So the whole point is Part B has a premium. Now keep in mind, this Part B premium is based upon your income. 93% of all people right now are paying that. So if you're a single filer, and you have $97,000 in income or less, you'll pay $164.90. A married filing joint return, $194,000 or less, again, you'll pay that $164.90. If you're above those amounts, then you're going to have an additional surcharge added to your Part B premium. I've got a lot of videos on that you can find as well. But the point is, no matter how we use our Medicare insurance, we have to be enrolled in A and B. So once we're enrolled in A and B, we have 2 systems that are available to us. One of those is to stay in original Medicare A and B, which means Medicare is the first payer. I go to the doctor, go to the hospital, Medicare is going to pay the bill first. Now in this system, when Medicare pays first, other than preventive, they don't pay for anything 100%. So there will always be gaps that are remaining or balances to the bill. If Medicare pays first, you will have a balance. You'll have a responsibility. You're going to have a liability to that. And so what most people do is, because they don't like all the gaps, they will go out and they will actually buy a supplemental plan, also called a Medigap policy. And that Medigap policy, depending on what they buy, is going to fill in some of the gaps that Medicare did not cover. All right, so A and B pays first. We get a supplemental plan to fill in the gaps, either fully or almost in full, so we're not having to come out of pocket in that scenario. And then when I stay in this system, then what we do is we add a prescription drug plan. These are called Part D plans. And in this scenario, these Part D plans, most zip codes have about 15 to 20 plans to choose from. So we actually pick a Part D plan that will be best for us based upon the meds we take and the pharmacy that we would like to go to. And here's what I want you to see. So I'm enrolled in A and B. I'm paying my premium to Medicare. I also have a premium I'm going to pay to a supplemental company. And the reason I pay a premium is because I'm going to get rid of almost all the liability of anything else out of pocket. I just don't want to assume any of those expenses. So I got to pay that insurance company a premium to take the liability. And again, there's lots of plans available, but most people today are buying an F plan, a G plan, or an N plan. I'd say the G plan today is probably the most popular. Okay, but the F is 100% coverage. It fills in 6 of the 6 gaps in Medicare. So when someone's on an F plan, they should never see a bill whatsoever. The problem is you have to be born before January 1st, 1955, eligible for Medicare prior to January 1, 2020 in order to get an F plan. Many people can't today because of that. Those born after January 1st, 1955, starting Medicare after January 1, 2020, most of them are getting a G plan. And what it does, it fills in 5 of the 6 Medicare gaps. The one gap it doesn't cover is called the Medicare B deductible. So when someone has a G plan, it's almost full coverage like the F, except one item. You would have to annually pay whatever the B deductible is. This year, that gap for the B deductible is $226. And again, that's once a year. Then the last plan that is still popular is called the N plan. What it does, it covers 4 of the 6 gaps. It does not cover the B deductible, and it does not cover excess charges when a doctor adds 15% to the bill. In addition to that, when you have an N plan, every time you go to the doctor, you'd be subject to up to a $20 copay, as well as to the emergency room, a $50 copay. So obviously, as we go down in liability, what's going to happen is I'm going to go down in premium. So when the insurance company is going to pay less and you pay more, then you'll pay less of a premium. And again, right now, most people are getting a G plan. So the whole point is I have a premium for those. And then when I have a separate drug plan, again, 15 to 25 to choose from in every zip code. And so these are going to range anywhere from $5, average is about $25 or $30. So I pay a premium to Medicare, I buy a supplemental plan, and I have a drug plan. Now, so this is one way in which you can use your Medicare. About half of all people today going on Medicare are opting to do that. The second option you have to use your Medicare benefits is to enroll in what is called an Advantage plan. Now, what this means, we have this Advantage plan, and this is now a private health insurance company that is replacing original Medicare A and B. I'm still enrolled in A and B, but now I have this private health insurance company. Could be United Healthcare, could be Aetna, could be Humana, could be Cigna. There's all kinds of companies out there that offer these plans, but it's a private health insurance company. And so what happens now, Medicare doesn't pay bills. Medicare actually pays the Advantage plan a fee on a monthly basis, about $1,000 a month. And so this private health insurance company is responsible for you. So what they will do, instead of having gaps, what you're going to do here is you're going to pay co-pays or co-insurance for all your services. So to go to a specialist, you may have a copay of $35. To go to the hospital may cost you $300 a day for maybe 5 or 6 days each hospitalization. You have an MRI or a CAT scan, probably costs you $200. Outpatient surgery, maybe $300. But the point is, if I have an Advantage plan, what I'm doing, I'm not usually paying a premium to that Advantage company, because instead my out-of-pocket expenses will be I pay as I go. But as I pay as I go, what will happen is they will always establish what is called an annual max out-of-pocket. So the plan, I'm responsible for copays, but the plan will say once you've reached a certain limit, you don't have to pay any more copays. And that ranges anywhere from $3,000 to maybe $5,000 on an annual basis. And then those max out-of-pockets will reset every January, and again, we're back to paying copays. But once we hit our max, you can put your wallet away, purse away, checkbook away, you're done. You don't have to pay anything else the rest of the year. All right, so that's pay-as-we-go plan. Over here, we pay more of a premium. Here, pay-as-we-go. And then with this system, what happens is they include a prescription drug plan. And so they pick a plan, they make it part of the coverage. And so when we go with the Advantage plan, we always have to make sure that our meds are going to be covered well, because over here, you got to pick your own plan. Here, the insurance company picked it. And sometimes those plans are very good and sometimes they're mediocre. So here's my point. When we go on Medicare, we have A and B set up. Now we're going to get insurance. And these are the 2 systems that we have available to us. You cannot be on both at the same time. It's going to be one or it's going to be the other. All right. And so what's very critical to know is this. On Advantage plans, you never ever have underwriting. And I'm going to show you when you can get those plans and switch those plans. But just keep in mind, in this system, there's no underwriting. You can always get the Advantage plan if you're trying to get one at the right time. Over here, it's going to be a little bit different, and this is why. Because supplemental plans, what happens is, and this would be in 46 of the 50 states. So what I'm getting ready to teach you applies in 46 of 50 states. The ones that do not apply, what I'm getting ready to show you, would be New York, Connecticut, Vermont, and Massachusetts. Those states, you can get supplemental plans really anytime you want without any underwriting. But the other 46 states, supplemental plans, here's the way it works. Let's say I'm going on Medicare A and B, and I'm going to start at 7/1/2023. And this supplemental has what's called a Medigap Open Enrollment Period, and it is tied to my B date. This is critical. So tied to my B date, what this means is I have this window of opportunity, 6 months. I can apply for a supplemental plan 6 months before my B date, and I can apply 6 months after my B date. And so what that means in this example, all of July, August, September, October, November, December, all those months, I can pick up any supplemental plan that's available in my state, any letter, any company of my choosing. Doesn't matter at all. All those companies have to write you during that 6-month window. They will issue the policy. They cannot ask you any health questions. They have to take all your pre-existing conditions. They absolutely will write the policy. But after that 6-month window, what happens is in 46 to 50 states, if you ever want to pick up a plan later, now you're going to have to medically qualify to do that. And so a lot of folks don't realize this open enrollment period for supplemental plans is very critical. And for some of you, it's the only time you're ever going to be able to get a Medicare supplemental policy. We have 6 months, so it's tied to the B date. Now, let me share this with you. Let's say that somebody enrolled in A only because they're going to keep working, and let's say they had a 7/1/2023 A date, and then they retired 2 years later, and they pick up B, and now their B date is 7/1/2025, right? That 6 months is now tied to this date right here. It's not tied to the A date. The supplemental Medigap Open Enrollment Period, where you can get it without any underwriting, will always be tied to the B date. So whatever the B date is, 6 months before, 6 months after, we can pick up that plan with no underwriting whatsoever.
Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out.
So once we've made the decision as to how we want to use our Medicare benefits, then we have the opportunity from time to time to be able to switch those plans. And there's certainly rules and restrictions to that, but I want to make sure you understand how we switch these Medicare insurance plans. So first off, let's say that I'm on an Advantage plan, found one that I liked, and I enrolled in the plan, and then something happens with the plan. They change the network, my doctor is no longer taking the plan, something happens I'm not happy with. So I can switch Advantage plans a couple times every year. The first opportunity I have is called the Medicare Open Enrollment Period Annual Election Period, and that's October 15th through December the 7th. So when I make a decision during this annual election period, my new policy would start January 1 of the next year. So I have the 7 weeks towards the end of the year where I have to compare plans. So if I make a decision to switch plans, that new one goes into effect January 1. Now, in addition to that, I can also, from January 1 every year until March 31st, I have another opportunity to switch, and this is called the OEP, and this is called the Medicare Advantage Open Enrollment Period. So what happens here if I make a switch, and again, I have to be January 1, I got to be on Advantage plan, but if I decide I don't like the plan in January, I can apply for another plan. It'll start in effective February 1st. And if I make the switch in February, it starts in March. I make it in March, it's going to start in April. So we have these first 3 months to make that decision. And after that, we're not going to be able to switch Advantage plans until later in the year, October 15th to December 7th. So that's Advantage to Advantage. Now, if I'm on an Advantage plan, and I would like to go to a supplemental plan. In other words, I've decided I no longer want to be in that Advantage plan. I want to go to a supplemental plan. I can do this, but it's very important to realize this. If you have been on your Advantage plan more than 1 year and 1 day, 2 years, 3 years, 4 years, whatever, 5 years, if you are in the Advantage plan, that period of time, you want to move to a supplemental plan. In most states, what happens, you can do that anytime October 15th through December the 7th. Okay, but we have to go through underwriting to make that switch, because the supplemental plan, as you saw in a previous slide, when you first go on Medicare, remember 6 months of your B date, they have to take you. They're required to. But if you go on Advantage plan first and stay on it more than a year, now what happens, that supplemental plan can now require that you go through underwriting. So now we're going to ask you 25 or 30 health questions, check all your medications, you may have to get a statement from your doctor. So that underwriting process means that information on your pre-existing conditions, your present conditions, all that's going to be given to the insurance company. If they like what they're saying as far as your health, then they can say, yes, we'll give you and we'll issue that supplemental policy. But if they don't like something in your health records, AFib or rheumatoid arthritis or spinal stenosis or maybe insulin-dependent diabetic with complications, now they can say, no, we're not going to approve that policy, and then you'd have to stay on that Advantage plan. But if we want to make the switch, this is the time of the year. In fact, this time of the year it can be done, and then that supplemental plan would start January 1 of the whatever year you're going to apply. You can also do it during this period of time as well. If we're on Advantage plan, the first 3 months I can make that same switch. I can go right to supplemental plan. Now keep this in mind when you do that. Your Advantage plan included a prescription drug plan. Your supplemental plan will not. So not only are we making a decision as to what supplemental plan you want to go with and what company, now we're going to add a drug plan to that. All right. In fact, it's that drug plan that actually kicks out that Advantage plan. And so we always make sure we get approved by the supplemental plan before we add the drug plan, because again, it will kick that Advantage plan out. Okay. And so keep in mind, this is going to have a separate premium, and so will this. But here you got to choose which plan you want. With your original Advantage plan, they picked one for you. Now, another way, we could be on a supplemental plan and we want to move to an Advantage plan. Okay, so when do we do that? The only time we can do that is October 15th through December the 7th. Okay, and that plan would kick in January 1. And keep in mind, when I move sub to Advantage, there's no underwriting required. If it's in your zip code, it's in your area, then you can have that Advantage plan if it's going to be in your best interest. But again, I can't do that during the first 3 months of the year. That's not possible over here. If I'm on that supplemental plan, this is the only time of the year that I can actually do that. And then if you want to go a supplemental plan to a supplemental plan, meaning you just want to switch companies or switch letters, then you can do that anytime. All right, anytime. Now keep in mind, when I say anytime, as long as you can pass underwriting. Now here's the way it works. In 38 states, 38 of the 50 states, to make this supplemental plan to supplemental plan switch, you can do it any time of the year, but you got to go through medical underwriting. There are 12 states that do not require that, meaning there are certain times of the year where you can make that switch from a G to a G or an F to an F, and you can make a switch to a plan without no underwriting, but it's limited. Some states it's 60 a day, some states it's 90. There's a variety of rules on switching depending on where you live. But just keep in mind, in most states, to make the switch to switch, yes, you can do it any time, but you will have to go through medical underwriting. But if you live in a state that doesn't require that, you have to find out, when can I do that? Enrollment is tied around either the anniversary of your policy or around your birth date or certain months that state has specified. All right, so we can switch those plans. All right, so this is the time frame in which you can improve your position, save money, change coverage types, but you got to do it again within these time limits, because Medicare says this is when they'll look at the applications and this is when they will make these new policies effective.